Welcome. I'm Dr. Howard Lux.
I'm Dr. Jeff Berg.
We are Two Boneheads, bringing together our orthopedic experience to address your issues and concerns. Today we're going to be talking about do we have to tell a runner, especially a middle-aged runner, that they have to stop running? You know, I'm a runner. That's why I have this skinny, drawn-out face. And I incur a number of injuries along the roads and the trails, but I often don't have to stop running. Yet it's common to see a second opinion where the first doctor had told that patient that they need to stop running. Why is this happening?
Well, I think, as you said, people develop injuries. They go see a doctor, and the easiest thing for that doctor to say to them is, stop it. And you know what? Most of the time they'll get better. So that doctor's a hero, and he's right. But I kind of try to figure out how much can a person do without stopping and being safe and not having injuries. And I think that's where the key is, and that's probably the best thing for our patients. So what do you advise them, Howard?
I agree, Jeff. So, being a runner, it's very interesting. And being a runner, it helps to treat runners, or same goes for any sport, I guess, because I don't only run so that I get my aerobic exercise. I run so that I feel whole. If I'm starting off my day in a run, my day is going to go better. If I know I'm going to run at the end of the day, I know I'm at least a little happier. Running completes many people. So the worst thing that we can say is you have to stop running. Now, there are some injuries that you have to stop running for. Those can be stress fractures around the hip, stress fractures around the tibia. What are some of the injuries that the runners can keep running with? Jeff?
Well, I think the key is, so there's a lot of things you could keep running, but you may have to adjust how much, how frequent, the intensity, where you're running. And so, there's a bunch of pains and strains that aren't that bad, but what's happening is the runner is doing more than perhaps their body is able to do, or they're not giving it enough rest so that it's not healing the problem. And I run not nearly as much as you, but you get this sort of endorphin flow. You get a little good feeling, you get a high from it. And so runners start to run more and more and more as a natural tendency, and then they develop these injuries. And sometimes the answer is just simply cutting it back.
Agreed. Especially when you're over 50, you have to respect your recovery. A lot of runners don't know what recovery is, but recovery is actually a fairly active process. You have to give yourself a day's recovery. Oftentimes, especially in runners over 50, we have to consider a running week to be 9 days long and take 2 days off, as opposed to when we were young and we pushed it and we had a running week of 7 days and only had to take 1 day off. Another issue I run into is that most novice runners, they don't understand running. They don't understand that most runs are long and slow. They just tend to go at the same pace. They just go 8-minute miles for 5 miles every day. How do you address that?
Well, I think it's a lot like most sports, right? Particularly as you get older, you got to cross train. So I'll often tell people, as you said, take days off. And in those days, they don't have to rest, but they have to rest their legs. The bones can break down, the tissues can break down. And as you said, particularly as you get older, your healing is so much slower. And I think our brain tells us we're 20, but our body tells us we're 50. And so you have to match your brain to your body. And that's a hard thing. I think it takes 20, 30 years till you figure that out.
I love that. You got to match your brain to your body. I'm going to use that one in my office.
Yeah. So, and I find it with myself. I'll exercise, and I'm just starting to look at exercises and saying, you know what? I can't do that anymore. So I'm going to sit here and run in place, or I'm going to do push-ups where they're jumping and up and down. And the same with running. You remember back, like you said, when you were younger and you ran 8-minute miles 5 days a week, 7 days a week, on and on. You just can't do it when you're older. And you have to get your head around that. You can keep running. That's the best thing. You're out there and doing things. but maybe slow your pace, maybe take some days off, maybe cross train, swim or bike a couple other days. And I think that's the key to keep running as you get older.
I agree. You know, most runners do not need to stop running, at least completely. They do need to alter their training. They need to incorporate more long, slow runs, maybe, as Dr. Burke pointed out, a different intensity, a shorter distance, because we know the emotional and psychological downsides of not running. And the last thing we want is for you to have to rest a month and then not want to get back into running. That would be a tragedy.
Well, and even that makes a problem, because as you take time off, particularly as you get older, we know you lose muscle mass and strength. You're going to lose bone density. And then when you get back running, most people start up right where they left off. And now you have even a bigger risk of further injuries and stress fractures. So taking off isn't always what we want to do. Cutting back's usually the treatment.
Excellent advice. Well, folks, two orthopods and two boneheads signing off. Take care.
Have a great day.